In this video we are going to see about the nasal cavity. First let's see the boundaries of the nasal cavity. Think this is a small room where the roof is formed by the cribriform plate of ethmoid bone. The horizontal part of this ethmoidal bone come down and plays a part in the nasal septum, and also the cribriform plate at the top forms the roof. Then the floor is formed by the hard palate. It's anteriorly by the maxilla and posteriorly by the palatine bone. This hard palate is formed by both the maxilla and palatine bone, which forms the floor of the nasal cavity. Then the medial wall is formed with the nasal septum. We see the parts of the nasal septum later. Then the lateral wall, it is divided into three parts. The anterior opening, which has anterior nares or hair. Then the posterior opening has a posterior corona. Then there are three projections which can be called as concha or turbinates. The superior concha is also known as supreme turbinate. Then there is a middle concha or middle turbinate. Then the inferior concha or inferior turbinate. The space between the superior and the middle concha is known as superior meatus. Then the space above the superior concha is known as supreme meatus, or so as an order we can say supreme meatus, superior meatus, middle meatus, and the inferior meatus is the last down part. Superior meatus, middle meatus, inferior meatus. This is not called as supreme meatus. It is known as sphenoid recess, and it is a space above the superior turbinate. Just special and rare condition, guys. Then when come to the lateral wall of nose, the most common infection is the nasal vestibulitis, which is the any furuncle in nasal vestibule. As we all know, the furunculosis is most commonly caused by the staph aureus infection. It will present as pain and swelling, red and hard with abscess formation. The treatment is systemic antibiotics and analgesics. This vestibule is a very dangerous it is a part of a dangerous area of face, because when it goes infected, it can directly communicate with the cavernous sinus. The dangerous area of face is the area between the upper lip and lower part of nose. You can see upper lip and lower part of nose means drains into cavernous sinus through tertiary plexus. Infection of this area causes cavernous sinus thrombosis, guys. This is a very severe condition, cause obstruction and cause stroke or paralysis. Then when you see about the nasolacrimal duct, it opens into the inferior meatus. That is, inferior meatus is present between the inferior concha and the floor of the nasal cavity. It opens through a valve known as valve of Hasner. When we need to go into the nasolacrimal duct, the pathway is first we need to go inwards, then laterally or downwards. We can also say, if you are in the middle canthus from the eye, then you should go downwards, then you should go move laterally, then you move inwards, and we can reach the inferior meatus or middle meatus. Then infection of this national duct is known as chronic dacrocystitis. So you should perform NLD syringing or DCR, dacrocystorhinostomy, to treat this chronic dacrocystitis. Nowadays endoscopic DCR is available. Then we need to know about the osteomineral complex, a very important complex. It is present in the middle meatus, that is, it contains many group of air cells, and also three sinuses open at middle meatus: frontal sinus, anterior sinus, and maxillary sinus. So any infection in this osteomineral complex will cause a block of all these three sinuses. Then when we came to know about the anatomy of the lateral wall and nasal septum, this lateral wall is made up of 8 bones. So it is 4 sinus bones and 4 non-sinus bones. The sinus bones include frontal bone. You can see this is the frontal bone, giving a part to the lateral wall. Then ethmoid bone, you can see here the ethmoid bone giving part as middle turbinate. So then sphenoid bone, you can see the part of the sphenoid bone here. Then the maxilla. Maxilla, it present as a crest of maxilla. It gives a part to not crest. Maxilla part itself gives the part for lateral wall. And then other nasal bones, on other non-sinus bones like nasal bones. Then inferior turbinate is a separate bone. Then the palatine bone, you can see the palatine bone here. Then the lacrimal bone, you can see the lacrimal bone is small here. So these all forms the lateral wall anatomy. Then when we see the medial septum or nasal wall, nasal septum, medial wall or nasal septum, it is divided into 3 parts. First, this is a columnar septum. Then there is a gap known as membranous septum. This is the area of piercing normally human do. Then there is septum proper. This is the septum proper. It contains 7 bones, of which 4 are paranasal sinus bones. Then other 3 are non-paranasal sinus or no nasal bones. This paranasal sinus bones include the perpendicular plate of ethmoid. As I said earlier, this is the part of ethmoid bone. Then the rostrum of sphenoid, this is the part for medial wall. Then the crest of maxilla, you can see the both the maxilla plates combine to form a crest known as crest of maxilla. And then other 3 nasal bones include nasal bone. You can see the nasal bone, that is the nasal bone. Then here you can also see the frontal spine of frontal bone, that is the crest of frontal bone also placed in paranasal sinus bones. Okay, then in nasal bones, nasal bone plays a role. Then crest of palatine bone plays a role. Then vomer plays plays a role. Okay, vomer is a cartilage. You can see about the different bones you can learn somewhere. Sphenoid bone, this is the superior view. It is resembling a bat or a bird. Next is the lesser wing, this is a greater wing. This is the ethmoid bone, this is the perpendicular plate. Then is here the cribriform plate. Okay, then there are many air cells, crystals, ethmoid sinus is present. Then you can see the palatine bone is the horizontal part, which makes the posterior posterior part of the hard palate. Then these are the vertical parts which place part in lateral wall formation. Then you can see the crest here plays a role in the nasal septum formation. Okay, then the dangerous area of nose is the cribriform plate of ethmoid, okay, present in lateral wall. As I said earlier, this is the osteomeatal complex, that is the opening of the middle meatus. You can see this is the maxillary sinus, this is frontal sinus. Okay, then this is the bulla ethmoidus or ethmoidal sinus, opening of ethmoidal sinus, all mediate to middle meatus. So this is a process hangs down and closes this meatus, is the uncinate process. You can see this is the refractor middle turbinate. We can see all this. You can see the as opening for opening of this maxillary sinus, then frontal sinus here, and then the bulla ethmoidals also you can find here. All this open into the middle turbinate, middle meatus. So this process is the uncinate process which covers all these. Okay, if there is any block here, it can any blockage, it can also block to all the 3 sinuses. So this osteomeatal complex is very important. This uncinate process can attach to this anywhere like lamina papyracea or into the skull base or into the middle turbinate itself, affecting the drainage of frontal sinus. As you can see the clear view, middle turbinate. As a middle turbinate, you can refract, you can see uncinate process in bulla ethmoidals. This is the infundibulum, that is opening for this This very narrow part is the hiatus semilunaris. You can see the bulla ethmoidalis. This is the suprabulbar cell. A part of is also a ethmoidal-ager cell. Then you can see the halar cell or infraorbital cell. This is also an ethmoidal cell. Any inflammation of the cell causes the blockage of the drainage of maxillary sinus. Okay, let's see about the anterior ethmoidal cells. First of all is the bulla ethmoidalis cell. This is the most consistent cell of ethmoid. It drains into the middle meatus, as I said earlier. Then, as I said earlier, suprabullar cell. Here the suprabullar cell is also anterior ethmoidal cell. Then infraorbital halar cell. You can see the halar cell. Then agger-posterior cell, which is present in the medial side. We can appreciate later. Okay, I can say this. There are two types of cell. Agger-posterior cell, no, it is also present in the lateral side, which is present as a small cell. Okay guys, okay. Then is the anterior most cell of ethmoid. It is closely adjacent with lacrimal bone. Okay, we can see in the diagram also. You can see this is the bulla ethmoidal. This is suprabullar cell. This is halar cell. This is the maxillary sinus. You can see the opening. The halar cell, if it is inflamed, causes blockage of drainage. Here the side is very narrow. Here this side you can see suprabullar, bulla ethmoidalis, and a halar cell. Here this is very narrower than this side. Okay, this is the middle turbinate. Okay, yes, okay, this is the inferior turbinate, is the infundibulum. You can appreciate in all these diagrams here. You can see the agger-posterior cell present in someone. Here it is not present, agger-posterior cell. Okay, then let's go into the classification of frontal cells. Okay, see, in some cases left halar cell is larger than right. Okay, so any inflammation easily can cause block drainage pathway. You can see, as I said, this is the left is the right. Okay, left is narrower than right. Then frontal cells, there are four types of cells. First one, type 1, single cell above agger-posterior. Okay, this is known as supra-agger-posterior cell. This is present in the medial side. Okay, it is, so it see, this is a supra-agger cell. Okay, it's present above the agar cell. Okay, then type 2, there are multiple cells above agger-posterior. There are multiple cells above that agger-posterior. Okay guys, you can see supra-agger cell, suprabulbar cell, a part of a anterior ethmoidal cell present on the lateral wall. Then okay, there are type 3, inside the frontal sinus causes. Okay, this is the frontal sinus. Cells are present here. Agar cell, supra-agar cell, then multiple supra-agar cell inside the frontal sinus causes the sinus accumulation inside the frontal sinus causes central office headache, characteristic headache of frontal sinus blockage. Then type 4, acca-lonar or satellite cells. Then type 2 and type 1 and 2 are present outside the sinus, whereas other cells present inside the frontal sinus. Optic nerve is present in front lateral of sphenoid posterior superior aspect. Okay, then the ICA also present in lateral wall of sphenoid sinus. These are the characteristics of sphenoid sinus. Okay, you can see the anterior ethmoid here, posterior ethmoid. Okay, then sphenoid sinus, frontal sinus opening. Then maxillary sinus opening also in the middle meatus. Then nasal in the inferior meatus. This is the frontal sinus. This is supra-agar cell. Okay, you can appreciate here present in the medial side, not really medial, but it's in the anterior most. Okay, anterior most. Okay, then suprabullar cell, part of ethmoidal, anterior ethmoidal. Then you need to know about the superior orbital pressure syndrome, where it's open into the orbital cavity. So any constriction to this causes damages nerves like lacrimal nerve, then frontal nerve, parts of this trigeminal nerve, then superior ophthalmic vein, the subduction nerve, oculomotor nerve, nasolacrimal nerve, except the optic nerve, everything will get affected. So it causes conditions like ophthalmoplegia, proptosis, steroid pupil, lacrimal hypersecretion, eyelid high, forehead anesthesia, then loss of corneal reflex. Okay, there are separate openings for optic canal. This optic canal contains optic artery, ophthalmic artery, and the central vein of retina. You can see this is a superior orbital fissure, and this is the foramen rotundum. This is the Vidian canal. Okay, guys. Then cavernous sinus, cavernous sinus have nerves and arteries compared to all other, is the only sinus which contains nerves and arteries compared to all other venous sinuses. The only two things like internal carotid artery and the sixth nerve travel through the central part. Others like 3, 4th, then V1 and V2 of trigeminal nerve all passes through the lateral wall of the cavernous sinus. The cavernous sinus thrombosis causes very drastic condition like these nerves will get affected. Okay, it's need to be differentially differentiated from orbital eye syndrome and superior orbital fissure syndrome. Okay, in cavernous sinus thrombosis, this Horner syndrome is present due to the sympathetic chain involvement, but it is not present in the superior orbital fissure and orbital eye syndrome. Okay, then we need to see about the posterior ethmoidal air cell, which is a Odoni cell. Onode cell is present in posterior most ethmoid. Okay, it's present lateral to the sphenoid sinus. Okay, this is the sphenoid sinus case. Then these two are the Odoni cells. Okay, it is closely related with the optic nerve. So you can see this is the optic nerve. So when you are going for drilling with the into the Odoni cell into the sphenoid sinus, you need to be careful. You should not go straight. You can hit this optic nerve, it cause blindness, immediate blindness. So you should be taken diversion to the sphenoid sinus. Okay, the sphenoid pneumatization can take place. These are types like conical pneumatization, pre-cellular pneumatization, cellular pneumatization, then mixed pneumatization. Okay, in the cellular pneumatization, more air is present, whereas in conical pneumatization more bone and less air is present. Okay, as I said, this has surgical importance during pituitary surgery. Sophisticated instrument required. Okay, more rate of complication in conical pneumatization due to more bone. In case you need drilling, experience surgery needed, care to be taken for not to damage optic nerve and ICA. Okay, thank you for the video, guys.